Namaskaram. If you look at population who are beyond 40 years of age, back pain is fairly common. Now, the most common cause for back pain is spasm or prolapse intervertebral disc or sciatica in common term, that is it called. But we see a very interesting subset of patient coming to us with back pain in the neurovascular clinic. These patients with back pain are typically having spinal vascular malformation. What is the spinal vascular malformation? Basically, the brain connects to different parts of the body through the spinal cord. So, spinal cord is a very important structure. It is protected in vertebral column. Vertebral column is basically a bony cage which is made of small vertebra which is placed one over the other, and because the vertebrae are bones, there can be friction between two vertebrae. Hence, there is a disc kept in between two vertebrae, like there is a washer between two bolts. So, now in the vertebral canal, the spinal cord is very well protected and it gives rise to right and left nerve at each level. At thoracic level, at the lumbar level, it gives rise to right and left spinal nerves. Now, if the disc becomes elongated, it touches or pinches or compresses the nerve, patient typically will have pain across that nerve, which is called sciatica pain when it happens at the level of the lumbar disc L4, L5, L5S1. But we see the patient who are coming with spinal vascular malformation. So, spinal vascular malformation, generally it can happen two types. One, there is a arteriovenous malformation in the spinal cord per se, or there is a spinal cord, there is a vascular malformation over the covering of the spinal cord, which is called a dura. So, spinal dural AV malformation or spinal cord AV malformation. These are two types of disease we commonly encounter. Sometimes we can have vascular malformation in the vertebra in terms of a hemangioma, or a gross vascular malformation also we can see in the vertebra, which can affect the bone, the spinal cord, as well as the dura or the covering of the spinal cord. Now, how does this vascular malformation of the spinal cord present? How they are different from sciatica, which is common? Now, this spinal vascular malformation presents with back pain with progressive weakness of the lower limbs. A young man who was perfectly fine complains of back pain, and slowly there is weakness over both the lower limbs, which progresses. It progresses so much so that the patient gets bedridden. He has to move with a wheelchair. Back pain with weakness of lower limb, which has progressed over within a month or two. Number one is back pain, number two is progressive weakness of lower limbs, number three is bladder and bowel involvement. The patient can have frequency of micturition. He will go to the toilet again and again every 15 minutes or half an hour, not able to evacuate the bladder properly, can another symptom. Number four, constipation. Every 2 days, 3 days, 4 days the patient will go for latrine. So, constipation, severe constipation, frequency of micturition, weakness of lower limbs and back pain. If all four combinations are present, definitely there is a suspicion of spinal vascular malformation. It should be confirmed by doing an MRI. MRI will tell us about the diagnosis. Once that happens, patient should come to an endovascular specialist. And what we do when patient comes, we do a DSA angiogram of the spinal cord. We pinpoint the diagnosis and the location of the malformation, and then we put a small tiny little catheter, go very close to the spinal cord malformation and embolize it with glue and lipidol, completely exclude it from the circulation under continuous fluoroscopy or stress subtraction angiogram guidance. And once we completely take care of the malformation, patient's back pain is gone, slowly he recovers from the weakness and